Hello, students. So today I'm going to show you how to merge and copy information from a previous note. Okay, this will help you when you're screening patients because you won't have to go through the whole templates tab and then start from scratch. Okay, so when you're on a blank note that looks like this, the first thing that you're going to want to do is add in your template. So most of you will be doing, well, in this case, you will always use the follow-up template. So you'll merge that in. Okay. Once you're here, this is where you guys will begin. So the chief complaint, you're never going to merge from the previous note because every chief complaint and every HPI narrative needs to be unique to the appointment. So I'm going to delete whatever's in the chief complaint, make sure that is blank. Okay. Next, we're going to the HPI. The HPI section. So here you're going to start with your suicide risk, PHQ-9 and PHQ-2. So you're going to click on this little downward arrow, and then you'll pull from previous appointment your suicide risk assessment, inpatient discharge, depression screening, your history of present illness, depression screening. All of this gets merged. So you're going to go ahead and check mark all of it. Okay, and you're going to click on copy. However, there is one thing that I want you to pay attention to. Please make sure that when you're check mark these boxes, you're pulling from a telemed follow-up or a new patient appointment. But make sure that it does not say therapy or PCP. Okay, remember these are all psych appointments. However, we do have in-house PCP and therapy. So make sure you are pulling from a past psych appointment. Okay, so now I'm going to click on copy, and you'll see that all the information gets pulled from the previous note. Okay, as I said before, remember your HPI narrative should be unique. So I'm going to go ahead and delete whatever was in there previously. Okay, that's from last month. So once you delete it, okay, now you have I always want you guys to double check PHQ-2, PHQ-9, your suicide risk with all the components, and then your HPI descriptors. The narrative you're going to write in once you've contacted the patient. Next, we have all of our histories. Okay, to add in your histories, you're going to go over on the right-hand side where you added your templates. You're going to click on the history tab. Okay, the first tab here, it says import all histories. You're going to click on the arrow. Okay, and then most of your histories or all of them should populate. Please make note if you see that something did not populate, for example, the allergies, you still need to go in here and make sure that you put in if they have allergies or not. So here we have allergies. If they don't, then you're going to put allergies verified. Okay, and then I'm not sure if this patient has allergies. It looks like they might. So you want to go ahead and put allergies verified, exit out. Okay, and it will populate. Okay. So please make sure every section is complete. There should be no blank sections. The current medications list you're also going to do with the patient once you get them on the line. So you do not have to do that right now. Remember, we're merging information before we call the patient. Okay, so we're going to go ahead and, okay, it looks like social history is done, all three components. Next, we have our ROS. You're going to use the little drop down arrow, pull from last month, click on copy. Okay, vitals, I also want you to confirm with the patient, okay, on the phone, because the vitals, the height and weight could vary. And then your examination, which is the mental status exam, you're also going to use the arrow and you're going to pull all of them from last month and click on copy. Okay, so now you have every section pretty much done, minus 2 or 3 of them, which you would have to do when you get the patient on the line. Okay, so now that you have all the info here, you're going to go ahead and call the patient. If they answer, you'll add in your chief complaint, add in your HPI narrative, okay, and your vitals. If everything else is the same from last month, then you don't have to do anything. You'll leave it as is. However, if this patient now tells you that they're experiencing ADHD symptoms, okay, or depression, then you might have to go in and adjust some of these values. So if they're experiencing depression, you're going to go ahead and ask them the PHQ-2 questions again, the PHQ-9 questions again, and then change it accordingly. Okay. That pretty much is how you guys would merge information from last month. Please let me know if you have any questions.